Okay, so today I'm going to go through the scheduling modules, show you all the features and functions that are available to you in scheduling, and then I'll go through the verification process, which is what creates your payroll records and your billing records. So I want to go to my patients menu, and I'm going to go to the patient schedules option. There are other paths to get to the patient schedules. You'll be able to get it within other screens. There's also an access path where you can access the schedules down the left-hand side of the home page, but this is the path I'm going to take today. All right, so when you first select your patient schedules option, you're going to be presented with a list of patients that have unassigned services. So that's the initial display. Now, how you get them to be unassigned services, if you're entering initial scheduled services using the schedule the initial assessment link from the patient encounter record, that will put those services on the patient schedule as unassigned. After that, how they get on the patient schedule is based on your 485 orders, or for your hospice, your care plan has orders listed. Also, any interim orders that you enter where your services have changed sometime within a certification period. Interim orders are both for home health and hospice. The only item that we don't post onto the patient schedules is something you would have listed on your orders as a PRN service. So since we don't know exactly when you'd be using them or if you're going to use them at all, you get to post those on the calendar, and they're only good for the certification period that they fall within. So I get to my patient schedule. So that's how we start the list, as they come from orders. So you just can't add anything you want to schedule. You're always following physician's orders. Okay, so the names that are sitting at the top of the calendars allow you to resort the information. So it works like a lot of the other screens. If you just select the heading of the column, it'll resort the information for you. So since I selected this one, it goes from oldest to newest. If you select it again, changes from newest to oldest. And if you select it one more time, it puts the list back in the original sequence. If you have filters, since you'll have more than one agency set up, you filter it by agency cell. You can also filter by agency type. So if you didn't filter your agency and you wanted to look at just home health or just look at hospice, you'll be able to do that. You can also filter by service category. Service categories are the standard categories that are in the list for skilled nursing, physical therapy, and so on. Now, when you filter by category, if you were to filter, let's say, for skilled nursing, this shows me everybody that has unassigned services, because that was the initial default, that has skilled nursing on their calendar. So they could have other disciplines, therapy, social worker, home health, or hospice aid. So I filtered it for skilled nursing, and this tells me of all my scheduling calendars that I've got these individuals that have unassigned services. Well, let me go and put this back in the original filter. Okay, payer reporting group. If you've got the reporting group set up and linked to your organization payers, you'd be able to filter by payer reporting group. For somebody who has home health, hospice, private duty, I would have this set up in a little more detail. So you see one that says Medicare hospice that gets attached to your hospice versus Medicare home health that would get attached to your home health payer. Now, your home health payer can have more than one Medicare payer. You can have your Part A, your outpatient therapy. There's two different types of Medicare denials you can obtain. So you could have multiple payers. They could all belong to the Medicare home health reporting group. And for your service status, again, the filter initially defaults unassigned, but you can change it. So you can look at a list of patients who have services assigned. At least one service has to be assigned on the scheduling calendar. You could have those that are unverified, which is a combination of both your unassigned as well as assigned. And then you've got one verified. So it would just give you a list of the patients where you have at least one service verified. These filters work the same like a lot of the other filters on screens. You can lock it down. So you can keep this group of filters so that every time you come back and access the screen, it'll keep the set of filters that you have from the previous time. When you're looking at this, you have the grid information. You have a hover over where you can hover over and see the patient demographic information. The phone numbers that were marked as preferred are the ones that have the bolded lines. The patient name allows you to access the patient scheduling calendar. So that's the link that'll get you actually into the scheduling calendar itself. There's also a little icon that sits over at the far right. It says View Patient, but that icon will also take you into the patient scheduling calendar. Now you'll notice that there's a number that sits under the service status column. Depending on the filter you've used, that will be the number of records. So for example, this says unassigned. I have 61 records with this individual that's sitting on their scheduling calendar that I have not assigned a caregiver to yet. This one shows 27 that haven't been assigned. This one shows 9. If you change the filter, if I were just to look at assigned, for example, you'll see that that changes. So you can see I have 49 that have been assigned. You can also, if you're looking at all of them for assigned and unassigned, just change it and you'll see a new set of numbers. So that's both assigned as well as unassigned. So I'm going to select this patient so I can get into their scheduling calendar. Remember, the name is a link to take you into the scheduling calendar, just like the View Patient icon is. Okay, now I have this patient set up for home health. All the features between home health and hospice work the exact same way. The only difference is this one will have the therapy utilization check on it if the patient for home health has therapies. Otherwise, the screens are pretty much identical with all the information that shows here. So when we look at the top information, the patient's name is a link to take me into the patient encounter file. So if you select this link, it will display the patient encounter record. So it took me into the patient encounter, drops me onto the orders tab. But this is the patient encounter record. To get back to scheduling, just select the scheduling link. So that's one of other paths to get to the patient's schedule. Have a question, will the private duty screen look like this one? Yes, it will. They're all identical. The only difference on the private screen is you will have different services scheduled than what you'd probably see on home health and hospice. Otherwise, they pretty much work the same way. Okay, both the patient and the physician have these little address books. You can hover over to see the demographic information. Then under the physicians, you have the ability to view the orders. So if you select the orders, you'll see the orders that are listed for this patient. So because I'm working in home health, I have the 485. If I had any interim orders, you would see the interim orders. And interim orders are things that take place sometime during that certification period. They can be an addendum orders, you're adding new services or additional disciplines to the orders for that time frame. You might be placing them. You might be doing a discipline discharge. You might be writing more PRNs. You might have medication orders. You'll see all of that on this screen. Now, in my example, I only have 485s, but you would see all the different types of orders listed here, along with the from date and to date for those orders. The status that the order is sitting in. All of mine just happen to be in state, but you could have them approved, you could have them sent to physician, you could have them returned from the physician. The ID is actually linked to the order, so you know which order this information is attached to. Sometimes when you get a lot of information out here, it's more helpful to identify which order this is linked to, because when you start working with canceling services and moving some services around, you may need to go back and look at the specific order. So that's what the ID is. You've got your disciplines. If you had any interim orders written for medications, case communications, those types of things, they would not have a discipline frequency and duration on there because they're typically narrative orders. Then the start date of the order. Now, if it's a 485 or a care plan, the start dates of the from and to dates of the order care plan if you're running it through the entire time frame. Now, if you notice this one, my services frequency and duration was 2 times a week for 1 week. So that runs me through the first week. So that's what that 2 times a week is good for. And then you'll see that again for 3 times a week for 8. So it picks it up after the last one and continues through the next one. So that's where your start and end dates come in. Now you also have an icon sitting to the right of this. If you hover over it, you'll see the narrative information that's actually written on a 485 or actually written on a care plan or whatever you've written on the interim order. So if your interim order was for medications, you'd be able to see all the medications that appear on the interim order. So that's what this little icon does. And it will also include, if you've written any PRN services, they will also show up in the same information. Okay, so looking down at this one, these 3 for skilled nursing happen to be on the same order. So you've got the same order ID and same order. All the narrative that's associated with this appears on this top line. So this is the narrative that's associated with the skilled nursing orders that list here. It's like this one. This one has narrative that's associated on 375. This information belongs to the top narrative. When you're through looking at this information, just hit your close. Now, because I'm doing a home health agency, I do have the therapy utilization link because I do have therapy services on my orders. So if you're in hospice, you will not see this link. And in home health, this link will be here, and you can also have a little icon sitting next to it that just tells you to look at the errors. And what this is actually going to do is it's going to allow you to change the scheduled service from a routine service to an assessment visit. So I'm going to select this link so you can see how this functions. So this is going to show me all the services that are sitting on an order. So I've got, in this case, these are all physical therapy visits, but if you had occupational therapy or speech therapy, those would be on here as well. So you'd be able to follow through the process. So you know you have to have an assessment visit done at least every 30 days. So I've got some already listed. So my next assessment visit that I need to have done from 10/21 probably needs to be done by 11/20. So I can change this by selecting from the drop-down and change it to the PT assessment visit. So now I've got it scheduled as an assessment visit instead of a regular visit. So that was on 11/20. So if I slide down again, I've got to have one before 12/20, so I probably need to do this one on the 17th. So I'll assign my assessment visit there on the 17th. And then the next one, I probably would have to do it on the 14th because I don't have a 17th. And so as we go through this list, 14th, then I've got to have another one done by the 12th. And I've got to have another one done by the 12th of March. I probably could do it the 14th or 15th, but I don't have one scheduled down. So all this is doing is changing your therapy services from a routine scheduled service to an assessment scheduled service. So that's what you're doing here. So once you're through with this, you can hit your save and recheck to make sure you have them all covered. And it'll go through and it'll tell you if you still have some issues or not. So I have no errors. So I'm just going to go ahead and save and close this. Now I'm back on my screen. Okay, let's talk about scheduling a PRN service. So you have the link to schedule a PRN. The link will not be here if you do not have any PRN services appearing on an order. I happen to have two orders that have PRN services. The first one I had written was between 11/22 and 1/20. It shows I have 7 left, so that's the remaining visits. I've already used 2 of them. And so my total PRNs that appear on my orders was 9. So if I wanted to start working within the new time frame, then I can schedule my PRN services within the new time frame. So can't go back and use these for any time frame because they fall within your order's certification period, or if you had written an interim order, it fall within that time frame. Okay, so I'm going to go ahead and schedule one for the 23rd. Now, you have the ability to hover over this to see what it would say for your PRNs, because theoretically, you can only use your PRNs for what you ordered them for. So if you had PRNs just for an emergency catheter change, that's all you could use the PRNs for. If you had PRN services for unscheduled lab draws, then you could have it say unscheduled lab draws. And so if you were trying to do an unscheduled lab draw and all you had was PRN for emergency catheter change, then you'd have to write another order for the lab draw. So if you're supposed to use them for what you specifically ordered them for. So I'm gonna put this one in. Now I'm gonna hit my save and add more because I want to show you what this is doing. So I'll hit my save and add more. You'll notice that my remaining visits are now 15 and I now have one that I've used. So as it starts counting down, when you have none left, you won't be able to use any more PRNs until you write new orders for them. Now these little numbers that are sitting over here, if you hover over them, they will tell you what date you used the PRN service for and gives you the note that you attach to it. Then once you're through with this screen, you can just hit your save and close. You can schedule a second or a third or a fourth if you needed to. I just wanted to show you what it did when I scheduled that one. So I'm going to go ahead and hit my save and close. Okay. So if you're looking over in the Encounter section, there is a link to be able to send a message. I will show you how to use it. I will tell you that it's not HIPAA compliant because it sends a message to email addresses outside of the Carefusion application. So it is not HIPAA compliant. So you cannot put in any patient confidential information in there, like their name, Social Security number, Medicare beneficiary ID, Medicaid number, and so on. So if you're going to use it, you need to be careful with the information you put here. But I'm going to show you how it functions. Okay, so I selected the link to send a message. If you're using team assignments, you could send this message to an entire team. So if I decided I wanted to send this to my North team, I could send an entire message to my North team. What this is going to do is it's going to find everybody that's flagged as the North team in the Associate Master File record. And if they have an email address, it will send them an email address. I'm going to remove this one. You can also flag this to send it by discipline. So if you wanted to send it just to the skilled nurses, you can send the same message to every one of your associates that's flagged as a skilled nurse. That's their primary discipline that has an email address in Carefusion in the associate file. You can also send it to individual associates. So if I wanted to send it to a couple of people, I just select their names out of the drop down. Okay, so here's the message, and this is where you want, if you're going to use this, you want to be careful entering the information. Whoops. Now, what you can do, which is acceptable, you can use the first two letters of their first name and the first two letters of their last name. So this is why I'm saying if you do plan to use it, no patient confidential information, but this first two letters of first name and last name are acceptable. And then once you're through with this, you hit your send, and everybody that has an email address in their associate master file will get that email, will get an email based on what I've just written. Now that I've sent one message, you'll notice that I have messages sent. Now it says one. This is also a link. You can open it up and send another message. Do I have a question?
Yeah, Craig, we have a question in regards to that email. So our internal emails to each other are HIPAA compliant here, the way we have our security set up. So would that change this message, or is this completely separate from our system?
This would be completely separate from your system. What I'm doing is I'm just sending a message out through the internet. So because I'm not sending it encrypted, it just goes out to the internet as encrypted. Okay. As not being encrypted. That's what we're doing here.
Okay.
So if you
it doesn't appear to have any, it's not sending any information. Excuse me. The message that you're typing doesn't send any information. What it's doing is it's flagging that a message was sent about a person. Is that correct, what I'm seeing here?
This message, this is the message I just sent. Everybody that's connected to a skilled nursing discipline, and these two individuals will receive this message in their email. So,
but within the Carefusion system,
it's not. Go ahead.
It's not flagging that you sent this message directly from that patient, though, right?
Not well. This one is because no, you're right. This one comes from an associate and it's just sending it to a team. So if you put the patient's information in the message, then it's flagged to the patient. So, and that.
Yeah. So we have our own.
That's why I said you can use the first two letters of the first name and the first two letters of the last name in the message. This passes the HIPAA regs. You don't want patient's name, you don't want their social security number, Medicare beneficiary ID. They even say not to use their medical record number in the system.
Okay, thank you.
So this message, once I sent it and it's recorded here, it was sent to email addresses outside of Carefution. Okay, so while you're on this screen, you could send another message. It pops up the same thing. You send another message, you can pick names and individuals and put in more messages from here. So you don't have to close that screen and come back and send another message from here. Okay, so what I'm going to tell you is that there is another feature within Carefution, and it's based on this unread messages link. This is internal messaging in Carefusion, and it sends it to one person within Carefusion to another person within Carefusion. So it's not going outside our system. This one, when you use this one, you'll be able to send messages to other caregivers. You can put anything you want in the message, names, Medicare beneficiary IDs, anything you want, because it's internal to our system. So, and you're going to learn how to use this whole messaging link through the clinical training, as there's a couple of features within messaging that allows you to send messages back and forth through the QA process. So when you're doing a clinical review, it uses this messaging system. So they're going to train you how to use this feature. And it actually is a very nice feature where you can flow, where you can send information to anybody that has a sign-in into Carefusion. So you'll be able to use that option for any internal messaging.
Quick question, Craig.
Sure.
Do those messages flag to the patient's record?
Depends on what you're doing. You can connect it to a patient and have the messaging sit out there, or you would not necessarily need to connect it to a patient. You can connect it to an associate, or maybe not when you're sending information. The part of the family portal where you give either the patient or family members access to it, the family portal, they'll have the messaging, the same messaging available to them, so they can send messages within the application as well. Okay, so I've actually had a request from somebody. I just recently trained to have this one taken off the screen so people didn't use it by mistake. I don't have an answer about that. I think we could just probably build an agency rule to take it off the screen, but some people like to have the messaging within the scheduling, and that was the original intent, what it had to do with the scheduling, really not any other type of information going back and forth about the patient. Whereas this one, this whole unread messages link is internal messaging. You can put whatever you want in it. Okay. I'm going to come back a little later on when I'm going through this screen and explain the mass cancellation, because I'm going to show you how to do single cancellations first. All right, so you have a link on here to add a pay only. There are going to be occasions where you do need to schedule another caregiver on for patients and link it to a patient. Usually your pay onlys are like for case conference team meetings, IDT review, holiday pay, orientation, those types of things. But in this case, you could have two two different situations. You might have three, but you can have two different situations. One where you might have a patient that's obese and you need two home health aides to go out and help turn the patient, but you can only bill for one of the services. So the other one you can't bill for. And so, but you need to get it on the schedule so that they both know they need to go. Another situation could be you hired a new clinician and they went through the orientation in the office and they're going to do a ride along with a nurse, for example, that is going to be providing that patient care. So they're just going to be observing and so on. And you want to get it on that patient's schedule so that they can coordinate their schedules to see the patient at the same time. So the third example, and I see this in locations that have contracts with managed care payers. The managed care payer of the services that you'd be providing and billing for are chore services, homemaker, companions. But they want a nurse to go out and do an initial evaluation or reevaluation every 60 days. So that would not be billable because the payment source is only going to pay you for the paraprofessional services. So that could be a third situation that you'd use this for. So I've got my agency and I have my patient, and I'm going to select another individual out of my list that's going to be doing this. I'm going to set this one up as an in-service. This is an associate that's going to be doing a ride along with another caregiver that's providing the billable service. So I'm going to change this. I'm just going to put it on another day real quick. Now you can schedule the times if you want to put times in for this caregiver to show up with the other one, or you can leave them blank and have this caregiver coordinate the time that they'll show up together with the other one, or maybe they need to meet somewhere and they're doing right along with multiple patients for that day. So I'm going to go ahead and leave it blank. Comments, you can leave comments blank, but I'm just going to put new associate right along. I'm just going to go ahead and put something in. You can schedule another one if you need to schedule another one from here, or you can just hit your schedule and continue. Okay, so I put that on the second. So here you can see that the pay only gets listed on the calendar. Theoretically, you'd want to make sure you've got it scheduled with a service that the actual discipline is going to provide. But I just stuck it on the scheduling calendar so you can see it. It does say pay only. You hover over it, says it's an in-service visit and the associate, and it tells you it's non-billable. So that's what you'd use this add pay only link for. You could use it for other things if you wanted to, but there's other paths to add pay onlys for holidays, case conference, IDT, those types of things. So there's other paths to do this. This is truly if you need to link it to the patient's schedule and get it on the patient's scheduling calendar. Now I'll come back and visit this choose discipline piece in a minute. When you're looking on the calendar, anything you see in red text is non-billable. So this one's non-billable. You could have other pay-only scheduled services like the non-billable assessment visit or other types of items posted here that would have red, excuse me, red font. You will also probably see red font on any of these blue services, which are your verified services. If you determine that it's not billable, so you might have had a volunteer that was knocking at somebody's front door and you needed to verify all the record but you wouldn't want to create a billing record. So you could actually turn that service into a non-billable service that would just create the payroll record. It's really it creates the information for payroll reporting is what it's doing. Okay. So when you're working with the calendars, you're going to see some color coding on the screen. Anywhere you see this big green square, this is going to be the first day of the certification period. If you see this color, this is the last 5 days of the previous certification period. Now, for home health, this is very helpful because you need to be able to schedule your assessment visit, your reassessment visit to do your recertification within that 5-day window, or know that you're going to discharge the patient. So it does show up for both home health and hospice, these two colors. It is sitting out there, so even if you're working in hospice, you're going to say, gee, I didn't research the patient because there isn't a green box here on the calendar, and I can see I've got 5 days to get it recerted. You can get them recerted up to 30 days prior, but this just helps you. So if you were looking at this and you didn't see a green square after this group, then you better either recert it or know that you're going to discharge the patient. Some locations know they're doing a live discharge for hospice within this last 5-day window. Others, they typically have it recerted and do have the green box next to this. So if I were to slide down, I think we're going into March. If I were to slide down, you'll see in March, there's no green square after the end of that certification period. So that just kind of gives you some guidance when you're looking at this patient scheduling calendar. Now, the scheduled services themselves, if they're in green, means that you've assigned a caregiver to that service. So all of these that have the green, this has a caregiver on it, Sissy Campbell, this one has Yolanda Primavera, and so on. So all of these that are in green have somebody assigned to them. Need to back this up. There are 2 unassigned colors. There's yellow that's unassigned, so you can see all of the services that are unassigned. And then you have the one that you've chosen to work with, which are these pinkish red ones. So that they're actually unassigned services for the discipline you've chosen to work with. That's where this choose discipline comes into play. So when you're working with multiple assignments for a discipline, you'd want to make sure you've got your discipline chosen over here. So if you look at this, this is my home health aid discipline that's been selected. These are all of my caregivers that are my home health or hospice aides or chore workers, or how they're coded in my environment. So if I were to change this, let me change it to skilled nursing. So I'll see all of my skilled nurses listed here, whether they're an RN or an LPN or an LVN. And you'll notice that on the calendar itself, that it changed the color. So all my skilled nurses are this pinkish red color, where previously the home health aides were the pinkish red color. Now, this whole piece works in conjunction with being able to do multiple or mixed assignments at one time for an individual caregiver. So it's going to be working from this section. When you're working on this with individual scheduled services, it's not going to matter what discipline you've chosen, because you'll be able to select what you need directly from the scheduling calendar. Now there's a box on here to show canceled. When you cancel a service, we put it into the background so that you don't see it on the screen. If for some reason you canceled the service and you need to see it, you'd be able to check this box to show cancel. Now when I go through and cancel a service, I'll check the box so you can see what it does. Also have the ability to look at service code. So what's on the calendar now is the discipline category. So that's what shows on the calendar. You want to see it by service code, then it removes that discipline category and puts service code. So this is an HHAV, this is an RNV, this is an INSEV, and so on. So that just gives you this service code information versus the discipline. Now, I would not find this as useful as I would seeing this to show service description. Service codes are up to 5 characters long. So locations that just have a handful of service codes, this might be helpful because it's always an RNV or an HHAV or something. But if you've got 20 RN codes, you could have them listed RN001, RN002, RN003, and so what do those mean to you? Especially if you're just starting out using the system, they don't mean a whole lot to you. But the service descriptions do, because the service descriptions actually pull the description that's connected to the service code. So you'd be able to see this. Now, with setting up your tables for home health and hospice and your private duty, your RN service code should say home health and whatever the service code is versus hospice and whatever the service code is versus assessment and assessment. I mean, you would know the difference. So you'd be able to see those with the description. So I would find the description much more useful than I do service code. So that I would definitely probably be working with the descriptions because that's what you would be picking from. Okay, I'm just going to take this off the screen so it reduces the size a little bit for me. Okay, the calendar has a couple other features. I'm starting on January. So it defaults to current month for a 2-month time frame. So here's January and February. If I wanted to go back to December, I can select this back arrow. Takes me to December, and then January's at the bottom. If I want to go forward a month, so I can move it, select the forward button. So if I wanted to go from January to February, so now it shows me February and March, I can see that. You do have the ability to move back and forth several months at a time. You have this little drop-down arrow. When you select it, it gives you a calendar. You do have these single back and forth buttons that allow you to move them back and forth 1 month at a time, but these double arrows let you take it back multiple months. So if I wanted to go back several months at a clip or forward several months at a clip, I could do that. So I took it from February to November. I'm moving in November to August, August to May. And so if I wanted to stop on May, then I can select a date out of the calendar. If I wanted this to really be April, I want to move it back 1 more month, I just select that button and select the date off the calendar. So now you can see I've got my April and May. The reason all of this is grayed out is this is prior to the start of care, so there wouldn't be a schedule, but that's how you can move back and forth. So you can have patients on service several years, and if you need to go back and look at a calendar from a year ago, you could do that relatively easy. Now that I've gone back to April, I want to get back to current day. Well, the word today is a button. If you select that word, it brings me back to my January, February calendar. You do have 3 views on the calendar, so it defaults to month. If you make a change to it, you can see a week view. So here's the week view. And then you also will be able to see a date view. Now in the date view as well as the week view, you're going to have an all-day row and then time frame. I'm going to drop this back into my week view so I can explain this. In the all-day row, if you have no time associated with the scheduled service, then it will show in the all-day row. If you have time associated with the scheduled service and you verify the scheduled service with the time, it'll show in the appropriate time frame on this screen. And it does the same thing in the day view as it does in the week view. So if I were to look just on the 27th, I would see this on my day view. If I were to look on the 26th, the 25th, I'd see these on the week view. So it will, if you have both those with no scheduled times associated with them and time associated with them on the same day, you'll see it all plotted out on the day and week view. Okay, I'm going to put this back in my month view. Okay, one of the other colors that's sitting on here is this blue color for verified. This means that the service was provided. Hopefully it was provided when you verify the service. And what you're doing is you're looking at a scheduled record and verifying it for accuracy. So it creates a payroll record for your payroll reporting and a billing record. When you verify that service to create the billing record, it will change this color to blue. And that billable service, it gets put onto an unbilled invoice. If that unbilled invoice does not exist for the billing time frame, it'll create an invoice number and put that onto that unbilled invoice. If it has an existing unbilled invoice for that time frame, it'll just put it on that unbilled invoice along with other services that are going to be billed during that time frame. So that's where you get the blue, and you're really, like I said, you're really verifying it for accuracy, and we'll talk about that a little later. Okay, now when you're working with individual scheduled services, you can do several different things. So let's say that, for example, this HHA visit was going to be done on the 12th and not the 11th. You could just drag and drop it over to the next day. You can drag and drop and change dates of services as long as they fall within service frequency. If they don't, they'll tell you that. And if you need an additional service during a time frame where you don't have orders for it, then you'll have to write an order to get it on the scheduling calendar. Or if you need to do, if you can use a PRN for that scheduled service, then you could put it on the scheduling calendar using the PRN link. Okay, now you can work with less stuff to do with the blue. The only things you can do with those that are highlighted in blue is add a scheduling note or send a message. Now I'll show you how to send the messages when we go through the list of things that are available. Now I have this one scheduled, and it's assigned to this individual. This individual calls and said, I can't do the service today. So you have two options. You can either reverse it and put it back in unassigned, or if you know somebody else that can do it right now, then you could reassign it. So I selected that scheduled service, and I'm going to select the edit to reassign it. And what this is going to do is it's going to present me with a list of associates for this discipline, because it was based on the service that this is the discipline. So this individual said they wouldn't do it. I just happened to be talking to this individual on the phone, and they said they would, and I could check it. If you do need to schedule times for these services, you can put time in and time out. You know, I typically only see time scheduled for paraprofessional services or shift work. For your clinicians, I usually see where they determine if they've got 4 patients to see that day. They determine who they're going to see for second and third. So I typically don't see time scheduled for them. But for hospice aides, home health aides, volunteers, I do see time scheduled for those. So you can schedule time and link them, or you can leave it blank. So I'll just go ahead and hit this. So what I did was I reassigned that service to a different individual. So here's the service that I just reassigned. Now let's say you talk to this person again on this day, and this is on a Friday, and she says, I can't do this visit either, but you don't know who you can give it to. All you have to do is select this unschedule. You'll get a little pop-up and just hit your continue. And now that service is not assigned to anybody. So you can see that it's sitting out here as one of the unassigned colors. Okay, so you have a couple of other options that are available to you if you need to cancel the service for some reason. And let's say this person called and canceled and said, I'm not feeling well this morning. Can we cancel this service? So you can cancel that service, put in the reason, patient's refusing service, and just put in not feeling well. Then you check this interim order box, so it creates a case communication interim order that you can provide to the physician. And then just hit the confirm. This whole piece, you most likely would not be using the pay only code piece. What it does is it allows you to set up pay only codes for missed visit documentation. Most locations don't use that. We put it in place when we switched over and updated how this whole cancel services piece works now. Before that, they were leaving it as a scheduled service versus canceling it. And it was causing some confusion. So if you're going to go that route with missed visits, then our clinical team will help you get that set up. But you don't really need to use that because you're writing your reason for canceling the service and all your comments, and you're going to create an interim order which creates that case communication record that'll go to the physician. Okay, so I canceled that service. I had a service that was on my screen that I eliminated. So if you want to see that canceled service, just hit your show cancel, and it will pop back up on the screen. It comes in a little bit different color. The legend shows that it's more of a tan color, and this one kind of shows it's more of a gold orange tan color. But this is the service that I canceled. And it's got if you hover over it, it tells you the reason that you canceled it. And this is the note that I added to it. So if you click on the note, that's where I said patient not feeling well. And that's what will go on the case communication. And now let's say the patient calls you back an hour later and says, gosh, I'm feeling so much better. Can you send the nurse today? Anyway, so you can select this canceled service, and you can reverse it by selecting the uncancel. And you get your little pop-up screen, just say continue. And now I put it back on the screen, so now it's one that I need to assign somebody. You can cancel services that are assigned to somebody. So I just happened to pick a record where it wasn't assigned, but you can cancel services that are assigned to somebody. Okay, also on this, you can add a note. And let me just put one in. So I want to do a lab draw this visit. So I can put that note in and attach it to that scheduled service. Now, when this has been assigned to somebody, you would be able to see the note. They'll see it on your scheduling calendar as well. So it's available immediately the minute you put that note in here. Okay, one other item on here, and I'll just use this same one, is this send message. So it's the same messaging that it's not HIPAA compliant. And you can select teams and disciplines and so on. Since this one doesn't have anybody assigned, I'm just going to send a message to somebody. And to remember, if you're going to use this messaging, that no confidential patient information in it. And so what this actually does, the one that I send the messaging, you have another icon that sits on here. Looks like a little call out icon. You can click on that to see the message so you can see what it says. Your caregiver will have that same icon on their calendar and they can see it, and it updates the messages sent file to this. Okay, if we cancel I have a question. When you cancel a service that changes the frequency for the week, and it then creates an interim order, does that go to the doctor for signature, or do we need to do something more? It will create that interim order, and it shows up on the Orders tab as a case communication that shows that it's been canceled. So you'll be able to see it. I actually think it shows up as a missed visit. I think it says missed visit interim order. And so you'll be pulling that one, either print it or fax it or send it to their physician portal. So yes, you do have to do an extra step. The system doesn't automatically send it to the physician. So, but that's in the patient encounter, and it will show up on the Orders tab. Okay. So that's pretty much how you work with individual scheduled services. Sitting over at the left is the discipline I've chosen to work with, is my home health aide. Is the one that's displaying. They're the ones that show up in this pinkish red color. I want to find and assign an associate to multiple services. So when you're looking at the list here, this list is based on the discipline you've chosen to work with. You have a little hover over that shows you their demographic information for that associate. Their name is a link. If you select it, you can see services that have been assigned to that associate already. So you could use that to make a decision if you do or do not want to assign it to them. That may be a good match, but maybe you've already assigned them more services than they should have for any given day. So that's what the name is. The match tells you whether they're a good match. The green bubbles are a good match. The red bubbles are not so good a match. If you hover over the red bubbles, they'll tell you what's wrong with them. These two are associate not compliant, associate not compliant. This one is not in the patient's area. This one, you could assign to this individual caregiver. What you really want to do is go through those that are your best match. And if you've exhausted all efforts to find one of them to accept this patient, then you can go to those that aren't. Probably would skip those that are not compliant. But then when you come across one that is out of the patient's area, and you can see it doesn't say they're not compliant, then you could assign it. So to assign this to the same caregiver multiple services, you select the schedule associate for selected discipline icon and another message. Regarding non-secure messages, they do not open up in the patient record. Correct, that's correct. They open up somewhere in the Carefution system where that little link that gives you the numbers, that's the only place they open up in, is in the patient scheduling calendar on that link. And this is a detailed session on scheduling, which I like. It will now be our responsibility to teach this to our team. Yes. But remember, I am recording this, so you can share the recording. Sorry for my confusion on this. It was just this morning we discussed other training sessions in the clinical aspect. We'll just be taught again then. Now, the clinical team has split up your training to accommodate a large staff. They usually only do it once too, but this training for the administrative if others were not able to attend this one, then you would, they can listen to the recordings and you can work with them.
Craig, I actually have some clarification question on that. We were told that these 7 sessions with you were really for our sort of like high level directors, that this was not for, that there would be more in-depth training as we move forward for staff. So you're saying that this training, because that is really not my understanding of what this was set up, what JP told us these 7 sessions were about.
Oh, my administrative training, which is why I sent out the invitations, my administrative training was for all of your in-office staff. And
that is
if they could not attend, they could listen to the recordings. And that's why when I laid it out, I kind of gave ideas of who could attend it. Like the intake training, it would be for your intake coordinators along with your your senior administrative people.
So I will forward the email, that discussion back and forth with JP, but okay. I was told this first 7 sessions were for, they called it like the executive team and our EMR team. It was representatives from those departments, but it was not the staff from those departments.
Got it. I usually did this training one time now in your environment. I've separated the home health from the hospice, where I would have done 2 trainings. And so my initial question was, do you want 2 trainings or 1? Before I set this all up. So, but as you can see, a lot of it's in one training, and I do record them. But go ahead and send me the email, and I will check with them, and then we can discuss the possibility of doing a second administrative training. You okay with that?
Yeah, we'll figure it out.
I can do a second training. I just was not expecting to. So send me the email, and I'll talk with JP about it. Like I said, usually when there's 2 agencies involved, I have either combined the training for home health and hospice, or I've split it. So I really do have another 7 sessions I could use for you guys.
Okay, thank you. Yeah, we'll get back to you.
Okay, thanks. All right. So let me go with assigning the services to the same associate. So I want to select the schedule associate for selected discipline. So this is going to present my screen for my associates. Now, I sometimes do find this useful for the scheduling the services. These are really filters that will change the listing for you a little bit. So if you only wanted to assign services to this discipline through the end of February, then you could filter this so it just gives you those dates through the end of February. Or if you wanted to block it out for 1 week or 2 weeks at a time, you could do that, and it would just show you the scheduled services for that time frame. So when you initially bring it up, it gives you all the scheduled services that are sitting out here that have not been assigned to anyone. So that you can do that. Also found where some nurses are available Mondays, Wednesdays, and Fridays, and the other nurses are only available on Tuesdays. So you could actually filter them a little further, so you could drop it down and say, they're only going to do the Monday, Wednesday, and Friday. And then whatever services I had scheduled on Tuesdays and Thursdays would still be sitting out here. So that would filter it for that time frame. Now, when you're working with these disciplines, I'm going to take these out. When you're working with these disciplines, you'll be able to see keeping the existing service, which is this HHA visit. Other disciplines have more to select from. My training environment only has this one. So nurses, if you needed to change it from an RN visit to an LPN visit, you could do that. If you needed to change it from an RN to an RN special assessment, you could do that, and so on. If you need to schedule times, you have the time on the screen as well. The associate, if you hover over it, you can see their demographics, but if you click it, you can see their schedule. We do tell you it's a good match in the discipline. If you do have more than one payer set up for a patient, where some services get pointed to one payer and others get pointed to a different one, then you could select those from here. Now, I'm looking at my checkoff list. I am using my advanced feature for my override, so I don't have all the availability sitting out here for the associate I've chosen. So I just select this override availability, and it now lets me check all these services. So if you want to assign all of these services to the same individual, and all you have to do is make sure you got all the rest of the information on the screen set up and hit your save. And so I hit my save. And what it's doing is, this takes a little bit longer, because what it's doing is it's looking at each scheduled service. And it's going through a bunch of edits. It's going to check to see if you've entered times if they're over 13 hours. It's going to check to see if you've got other visits the same day where you have overlapping times. If you've scheduled those, payer may require authorizations, and it could be a warning or an error message. So that's what it's doing before it assigns the services. Now that I've assigned the services, you can see that all my HHA services have been assigned. So now I've chosen to work with my skilled nursing. That's this pinkish red color. And on my skilled nursing, I said, I've called and talked to this person, and I said, we may be able to squeeze them in. Let's go ahead and assign at least some of the services to me. So I can select my calendar. I can, again, I can use the same set of filters if I need to. If I needed to override anything, I could. You can key in times. You can, all of those different things. So typically I don't see times entered for nursing services. And so let's say this person said that they can work all through the 14th of December, but not the 16th, 18th through the end of the year. So we'll just take these out. And so everything else is going to be assigned to this individual, and I'm going to hit my save. Okay, and again, it's going and it's checking a bunch of edits for each individual service that you're assigning. So this does take a little bit of time. It's not bad, but it does take a little bit of the time to check all of that. If you have any errors, they're going to show on the screen, and they'll tell you which ones it couldn't assign based on those errors. So right now, it's still doing a little bit of its thinking. Okay. So refresh my screen so you can see all my skilled nursing have assigned. If you recall, I had some in December that I didn't assign. So I have my skilled nursing sitting out here that I didn't assign. So if I needed to assign somebody to those, I'll go back to my skilled nursing group. I could pick somebody and assign them the rest of those. And it gives you the same screen. I've got to do my override again since I don't have availability set up for that associate, and then just hit my save. Okay, so I got all of those assigned, and so now I've got my PT is my next one to assign. So I've got my physical therapist discipline. Here's my physical therapy list. I've got some that are a good match and some that aren't. Now I'm going to go back to my skilled nursing because I want to show you how to reverse these assignments. So let's say this individual called you and said, I've got a problem with my third week of January. So on your schedule, on their schedule next to them, there's another icon to unschedule them. Okay, and so looking at this list, and if you're going to do this, I usually like to reverse this so that the ones that they can't do are here. So let's go from the 18th, 20th, 21st, and we'll do through the 28th. So these are the ones that I'm going to reverse the scheduling assignment. Then just hit my save. And then what I did was I reversed those. So on my January calendar, which this would be on, here's the ones that I reversed. So you can quickly assign multiples to the scheduled service or to the same associate, and you can actually quickly reverse them. Now, also on this screen over on the left-hand side is something called scheduling conflicts. This is when you need to take one of your associates out of this list so that you don't assign them to a patient. So that's what the scheduling conflicts does. So I have two of them listed down here. The first one, it just says patient does not want the associate to provide the service. So that means that you don't want to ever attempt to assign this any of the services to this associate. So they will not appear in this list in the red bubble or the green bubble. So they won't be on the list at all, so you wouldn't make the mistake of assigning them. My second one says associate does not feel safe in the patient's neighborhood. So I took this person out of the list, so they're not up here either. So I would not make the mistake and call them to try to assign this patient to them. So that's what you're doing. This conflict is for this patient only. They're still available for other patients unless you take them out of their availability list. So that's what this does. Then you've got your mass cancel. Mass cancel allows you several things. You can cancel by discipline. So if you want to cancel some of the services, you can cancel those. Let me take out my PT visit real quick. I keep sliding my screen. Let me take out my PT visit. So if this person said that they didn't want visits for a specific time frame, then you can cancel them. Check boxes means that they're all canceled. If you only want to remove some of them, like let's say they don't want them during the month of December, then just check the boxes for this discipline for the month of December. And hit your confirm. Oh, I'm sorry. Hit your reason first. And the patient's refusing service, around 10 visiting. And then you can create your interim order from here and hit your confirm cancel. And that will cancel all of those services. So now they're back in on or they're now canceled. So you can see that they're all canceled because I still have that show canceled box checked. And then if you don't want to see the canceled services, just remove it. Okay. Okay, so that's the patient schedule. So the next option I want to go through is the schedules detail listing. The schedules detail listing is your schedules reporting. You can create these reports either in the PDF version of the list. You can create them in a calendar format. The calendar that says show all for associates also includes pay onlys that you have scheduled for the associate. Then you've got a patient calendar. The spreadsheet is just a list, just like the PDF version is. These two reports that are in PDF and spreadsheet, the scheduling reports, they actually have some totals associated with them. And so it'll add up hours for you and number of visits and those types of things. That's what that one's for. Then there's one that's a timesheet report. Most locations don't use this because they're putting in service notes, but what the timesheet report does is it presents a list of patients that the caregiver would be seeing, and they can put in their time in, time out, travel time, and mileage if you need to collect it on a timesheet report. Like I said, since the service notes collect all that information, most locations don't even use that. Whichever report option you work with or you want to use, just hit your export button and you'll get the report. It'll either display on the screen or you'll have to open the file from your screen for the report option. The information that displays on the report will be based on any of the filters you've used as well as the dates. Now mine does sit on unassigned, so you can see those services that are unassigned. You have multiple filters. I typically like to look at verified and unverified. That gives you the complete picture of the patient scheduling calendar. So you can see anything that's assigned, unassigned, and verified. So you'd be able to see all of that. Now, if you need a cancel report for some reason, you can select verify and cancel, so cancel. And this will give you a report for cancellation. Let me back this up. So you can see that you get a report for cancel. Oops. Not far enough back. Okay, so this will give you your canceled report when you run the report. It'll put the reason on the report that you canceled it, any of the comments you entered for canceling the service. Or I find this useful as those managed care payers that give you the referrals and want to see what the services are canceled and why. So that'll give you that report. Any of these filters you use, just remember you can lock them down. So if I kept this group, if I decided I wanted to look at everything, I just want to lock the filter down so when I come back to this screen again, it'll keep those filters. Okay. Whoops. Oh, my training environment. Oops. Okay. So the next thing I'm going to talk about is the associate load balancing. And what this does is it allows you to easily reassign services from one associate to another. And so I need to, let me change my date on this real quick because I need the specific date so it has information. Okay, so, okay, I have another question. Let me finish this real quick because this will only take a few minutes. Okay, so I've got services that were scheduled on this day, and let's say David Adams called you first thing in the morning and said, I'm really sick and I can't do my visits today, and you need to quickly reassign them to other associates. So this list shows you all the associates and what services they currently have scheduled. These are the associate names that sit up here. The ones that are in red, if you hover over it, says there's a compliance issue. So David Adams calls and says, I can't do this. So you call Bill Creech and he says, I'll take Castle. So you can slide this over, just drag and drop. And while you're talking to him, he says, I'll take Aardvark also. So you can just drag and drop this. And then balloon, I'm demo 2. Denise says she can do this one. Now she's probably outside the service area. She usually is. And you're going to get a little pop-up that says not in the patient's area. Just say okay. So it just allows you to quickly read the file. Okay, here's my question. Can you only schedule inside each patient record, or can you see a screen that has all patients with open visits and scheduled from that screen? Nope, there is no screen that allows you to see a complete list of all patients and schedule from that one screen. Next part of that question is, or can you only use the unassigned report? Unassigned report will show you what's left, but you cannot schedule from the reports that are from the report detail. Also, drag and drop. I showed you how to do one of those, but we'll just go back in this patient scheduling calendar. And if you've got one that needs to be on a different day, like this was the one I had drag and drop, so let's just go ahead and put it back where it was. So you just select that item and drag it to the day you want to put it on. Now keep in mind, you can only do that if it falls within that discipline's frequency and duration. So for example, if I wanted to change this one down to the 28th, which is another week, it won't let me. So service date must be between this time frame. So you can, as long as they're within service frequency, drag and drop them to other days. Okay. All right. So now I want to talk to you about your verification process. So we're going to go to the Verify Services screen. What you're doing is you're verifying the accuracy of the payroll and billing record. So you're pulling up what was scheduled, and you'll verify that scheduled service to create both the payroll and billing record. So I'm going to go to my Patients menu, Verifications, Verify Services. Okay, so you're going to get a list of all services that have not been verified from today and prior, current day and prior. When you get that list, I actually like to filter this list a little bit to reduce the amount of services that are sitting out here in total. So for example, if you look at the bottom of my screen, you'll see 1,838 visits. And so let's say I want to filter this by my payment or by my patients. I can filter that. So out of 1,838 visits, I have 71 for this patient that I want to verify. I had another question. Can we talk a bit more about this? Our schedulers will have. Can we talk a bit more about this? Our schedulers will have to go to each patient to schedule. That's correct. They will work from this patient schedule screen. They'll select the patient that they'll be working with, and like for example, if this is the patient I want to work with, I'll get it all scheduled. So I'll do all my assignments on the screen for this patient. Then I will go back to my patient scheduling screen. So after I get all those scheduled, they'll be out of my list of unassigned, and I'd go to the next one. And then this opens up their schedule. So yes, they have to go patient by patient to do this. Easiest way I find to do this is through the patient schedule screen unverified, because that's the first thing you want to do is find and assign caregivers to it. So that's what that's doing. So there is no mass screen that shows you a patient and all the services, and there's nothing that gives you a whole listing of patient and what you need to do to schedule. Okay, so I want to get back to my verified services screen. So I'm going to go to verifications, verify services. Okay, I'm going to filter this by patient the first go around. You can also filter it by associate. So I'm going to, if I wanted to filter this by associate, I could even narrow the display of information a little further. So I went from 1,800 some odd visits, and then I had a 71 some odd for this patient. I've narrowed it down by associates, and I've only got 31 visits, which is a combination of this patient and its associate. I find it easier to verify the records here if I'm concentrating on one patient at a time, one patient and associate at a time, or one associate and all their patients versus the whole list. I just find it easier to filter. Now, when you're looking on this screen, you're going to have this little icon that's in the first row of icons. This first one gives you, it's either has a clipboard with a green frame around it, which means that you have a service note attached to that service and it's been completed. The clipboard with the orange frame around it means that you have a service note that's in an incomplete status. So the service note's not completed. The ones that are blank.
Hi, Craig.
Yes.
Hi, I'm sorry to interrupt. This is Jamie. I just sent you a message to unmute me, but I unmuted myself. I just have to get my head really clear on this because this is going to be very different for our schedulers now. So, for example, now they can look in the unassigned patient list and know, okay, well, for tomorrow we have this many patients that need nursing visits, and we adjust things accordingly. So if we have a ton of revisits, you know, it might affect how many new starts we have or where we place these visits, because, you know, you have a frequency of 2 times a week, there's some room where you can decide which 2 days a week they're going to get the visit, unless, of course, it's scheduled like an IV due or wound care is due. So right now with, you know, 250 patients on home health, the schedulers, you know, have their teams, so they're going to have to look in pretty much each day at each one of the patients that they're responsible for scheduling.
For just that one day? Just that one day or a week time frame or?
Right, because we don't, therapy we do schedule out like by the weeks or even the cert period because there's a little bit more consistency in that. But nursing wise, you know, we don't, if we have a frequency of 2 times 8 from the start, we don't usually plot them, okay, every Tuesday, Thursday, and it's going to go to this nurse. That's not our process. It'd be nice if it could become our process and that was reliable, but I'm just trying to think how to see what they need to do.
In the orders piece, which is what our clinical team does, in the orders piece, you're putting in suggested or recommended frequency and duration for the entire certification period. So if you said 3 times a week and block it out on Monday, Wednesday, and Friday, it sits on Monday, Wednesday, and Friday. It'll show up on the patient's scheduling calendar as unassigned. And so that's how it gets on the patient's scheduling calendar to begin with. You can filter the information to get to the patient. So if you need to work on one, if you need to work on a group today for tomorrow, for example, then when you're using this piece for the patient schedules, you can filter it for that one day. I would be inclined to move that to 1 week, but how they get on the patient scheduling calendar, your schedulers are not putting it there. It's going to already be there for them based on the suggested or recommended discipline, frequency, duration information, and that comes from the 485 orders, any of your interim orders, and it'll
Okay.
also come from your care plan. So it's already plotted out. That's where this number comes from. So if your, for example, if your schedulers can't assign somebody for an entire certification period that's been plotted out, or they can only do it for 1 week at a time, then you can filter for it through this information. So it'll just give you a list of those patients that have services that have not been assigned anyone.
So could you put in the from date, let's say tomorrow is the 26th. So from 1/26 to 1/26, and would just those patients come up that what was plotted was to have a visit on Tuesday and it's not assigned yet as of today, 1/25?
There you go. There's my patient that doesn't have anything assigned on the 26th.
Okay. And it was plotted, okay.
And that's my filter. And so I just selected it, says there's one for that patient. So if I had a bigger database, my training database isn't that large, but if I had a bigger database, you'd see the other ones out there.
There's no alert. There's no alert that comes out and says, hey, you have, let's say they didn't put that filter in. They're not going to get an alert that says whatever that patient's name was is supposed to have a visit and you haven't assigned somebody yet.
That actually sits in Workbasket. Workbasket shows you schedules, and if you have anything out there, it'll even tell you that you have an active patient that you have nothing scheduled for. So that actually sits in Workbasket.
That's a check and balance then. Okay, I forgot about the Workbasket. Okay.
Yeah, that's in Workbasket.
Thank you.
Okay. We're like about 5 minutes over. Do you want me to finish the verification process, or do you want me to pick it up in the next training?
I'll let Molly answer that.
We're talking.
Yeah. Yeah.
Okay. Sorry, Craig. I think, we're going to pick it up in the next one.
Okay, that'll work. And in the meantime, go ahead and send me that email that you said you have from JP, and I'll talk to him about it. I have no problem scheduling another set of these for you. I have no problem doing that.
I think we'll definitely need to we should just plan on that.
Okay.
Absolutely. Yeah, I apologize. My understanding from JP was that this was like leadership, executive committee, this was the very beginning, and that training wouldn't begin until we had all the associates set up. And since we don't even have our associates set up yet, that employee training wasn't to start till after that, till everybody had access to the system. So there's definitely been a very big miscommunication, and we need to figure this out.
Somewhere. So they didn't put your associates, they haven't pulled them from your database yet?
They have pulled them, but they're not cleaned up. I'm the only one right now on this call that has a Carefution account.
Okay.
So, they haven't.
Do you want anybody else to have access? Because that's easy to set up.
Yes, I mean, I'd like for everybody on the implementation team to have access.
So all the people I've sent the invitations to, you want them all, and what do you want them all to have administrative access, or that gives them access to every single thing?
Right. No, I think we'll have to. This afternoon I'll send you the roles for everybody.
Okay. So
but I can do that.
That would help, because it takes no time to get them set up. I can do that quickly for you.
Thank you.
Okay.
And all right. Thank you so much. Appreciate that.
Well, we'll just, I'll pick up the rest of the verification process at the beginning of the next training. And then I'll go ahead and once I get the access to you, then we can kind of work out the next time you want me to do this training.
Perfect. Thank you.
Okay. All right. Well, since we're going to stop for now, you guys have a great rest of the day, and it looks like our next training's for tomorrow. So we'll talk to you guys tomorrow.
Great. Thanks, Craig. Appreciate it.
Take care.
Thank you. Bye-bye.